Hi, welcome to the second part of my 5th lecture on the coronavirus. In the first part, I covered how antibody molecules can potentially work as therapies to stem the progression of a coronavirus infection. In the second part, what I'm going to do is do it's like the old high school essay, compare and contrast on different approaches that one could take to use the immune system to stem a viral infection or to prevent a viral infection. And so we'll cover vaccination as the first on the left here, and on the right, we'll consider passive immunization. So first, I'll cover how rapid of a response can you get with these two approaches. So with vaccination, it's slow. If I vaccinate somebody today, it's going to take, weeks to months before that person develops an effective immune response that could potentially block future viral infection. So this is not something that you do with somebody who already has coronavirus. By contrast, with passive immunization, you're introducing antibodies that have already been pre-raised, if you will, so they can start acting immediately. So this is potentially effective in treating people who have already had a coronavirus infection start. Now, the second thing is how long is the protection conferred by these two different approaches? With vaccination, it potentially confers very long-term protection. There's some vaccines where they'll confer protection for, a year, a couple of years. There's other vaccines that confer lifelong protection. So this is potentially very long-term. On the other hand, passive immunization is a short-term approach. And it's short-term because antibodies have a finite lifespan. They're constantly being degraded or removed from the circulation, eliminated from the body. And that happens at a rate that we refer to as the half-life. And the half-life is the time it takes for half of the material that you introduce to disappear from the body. And for antibodies, the half-life is about 21 days. So that's 3 weeks. So if I inject a bolus of antibody into somebody today, 3 weeks from now, they'll be half as much. 6 weeks, they'll be half again as much, so a quarter of the original dose. 9 weeks, they'll be an eighth of the original dose. And so passive immunization, while you can potentially give it to a patient who has coronavirus right now, it's probably not going to last. It's not going to confer any benefit for much more than a few weeks or maybe a few months. Okay, the third thing I'll cover is how do you actually do the procedure? What are the different ways of doing vaccination or passive immunization? So for vaccination, the methods are as follow. You can either get virus and neutralize the virus in some way, and that could be, you could either chemically neutralize it or you can genetically neutralize it. And that's often called attenuated virus. And that, you introduce that into the patient and it won't cause the illness, or it'll cause a greatly attenuated version of the illness. And your immune system could meanwhile mount a strong response. The other thing that is being done is to introduce nucleic acids, and that could be either RNA or DNA, that encode genes of the virus. And so if you introduce DNA, that can produce RNA, which can then produce the protein. If you introduce RNA, that could produce the protein directly. So the introduced nucleic acid is taken up into cells in the patient and then is expressed to make viral proteins, and the immune system recognizes those and begins mounting an immune response. The other approach is to introduce the proteins themselves, the purified proteins. And so, for example, one could purify large amounts of the spike protein and introduce that spike protein directly into a patient, and then the immune system would see that, begin raising an immune response. So those are the three major methods for vaccination. How about for passive immunization? The first method is what is referred to as convalescent plasma. And so what this is you find an individual who has had the coronavirus infection and has recovered from it successfully, and they have antibodies in their blood that are directed against the coronavirus. And the best case is if those antibodies against the coronavirus can actually neutralize the virus, can prevent the virus from infecting in a test tube measurement. And so you then you collect plasma from those donors, and you give it to people who currently have a coronavirus infection as a way to stem the progression of the infection. Now, that's potentially an effective approach. The limitations are that, number one, it's going to vary dramatically from person to person, right? It's hard to have good quality control with convalescent plasma. And number two, the amount of plasma you get from one individual can be used to treat only a very limited number of individuals, so a handful. So if you want to treat, millions of people, you need many hundreds of thousands of donors to millions of donors. And so, it's not the most convenient approach, but it's one of the more simple approaches in that you don't have to, create anything new. You can just rely on something that exists. The same is true of hyperimmune globulin. So the only difference here is what you do is you purify the antibodies from convalescent plasma, and you administer those antibodies. So you can give a higher strength dose in this way. Both of these methods suffer the same problems. As I mentioned, one problem is there's a limited number of doses you can produce per patient. The other problem is this is a mixture of many different antibodies, all the antibodies that person had in their body. It could be against thousands or tens of thousands or hundreds of thousands of different proteins. And so, the antiviral antibodies may be just a very small fraction of the total. The other approach is to manufacture antibodies. So you could make very concentrated antibodies where every antibody is directed against the viral protein and potentially neutralizes that protein. So these could be literally, many thousands of fold potentially more potent than these sources of antibodies, because here, every antibody is effective. Now, where do you manufacture those? You can get them from mouse, or you can get them from human. When you get them from mouse, what you do is you immunize a mouse that has a human immune system. The mouse makes antibodies against whatever you immunized it with a viral protein. And then you identify B cells from that mouse that make antibodies against the viral protein, and you clone out the antibody genes from those B cells, and you use those cloned genes now to manufacture recombinant antibodies that you can turn into a medicine. When you do it from human, what you do, it's the same steps as up here. You identify patients who've had an infection, who've recovered, and whose blood is making neutralizing antibodies. You harvest B cells from those patients, and you identify the B cells that make neutralizing antibodies. And now you clone the genes out that specify the antibodies from those B cells, and you use those cloned genes to manufacture large quantities of the recombinant antibody, which again you can turn into a medicine. And so these are the different ways one could use the immune system to try to either prevent infection by coronavirus or potentially, once an infection is underway, to slow the progression of that infection while the person you've injected, while their immune system is mounting its own response. Thank you for your attention. Have a good day.